What's going on, everyone? Welcome back to my channel. In today's video, we're going to look at rehab exercises for patellofemoral joint pain. This is pain that occurs on the front of the knee, in the joint, right behind the kneecap. And it's usually provoked with things like squatting, going up and down stairs, things like that, where we're using our quadricep muscles on the front of the thigh and activities that compress the kneecap and that joint behind the kneecap. So if you've got pain in the front of your knee, stay tuned for today's video. So again, patellofemoral pain has to do with the joint behind the kneecap. Our kneecap sits on our femur bone and rides through a track, so it has to do with that joint. You might also hear of a diagnosis called chondromalacia patellae, which has to do with a wearing away of the cartilage behind the kneecap. People who have patellofemoral joint pain don't always have issues with their cartilage. It's a multifactorial issue, and it's actually something that I've struggled with since a teenager. I had surgery. If you look at my kneecap, I actually had my kneecap was in two pieces and I had surgery on it, but it's an area I've had pain, for quite a few years and something I just work on managing, so it's one I know well. But again, that patellofemoral joint is just right behind the kneecap. So when it hurts, people will be, squatting again, going up and down stairs, and they'll feel pain that's on the front of their knee, but back behind the kneecap. And, not something they can touch and reproduce. Sometimes the pain will also occur if you sit with your knee bent for long periods. When your knee is bent, it puts more pressure on that joint behind the kneecap, and they call this a positive movie theater sign. So if you notice that sitting in your car, or maybe when you're eating a meal, you're sitting for long periods and your kneecap starts to hurt behind the kneecap, that could be patellofemoral joint pain. So we'll look at 4 exercises for reducing this type of pain. Let's jump into the first one. So for our first exercise, we are going to look at mobilizing the quadricep muscles. This issue, sensitive kneecap joint, is often associated with activities where the quads are contracting. So if we can get them to loosen up, it can kind of take pressure off of the kneecap. Now, if you have kneecap pain, kneeling like this probably isn't going to feel real good. Mine's not flared up right now, so it's not bothering me, but just be careful, just even getting down on the floor to do this. Just be careful with kneeling on your kneecap. What you're going to do is take a foam roller, lay it perpendicular, and we're basically going to kind of massage the thighs. So what you're going to do is just go into kind of a plank position and just roll. You're going to walk your arms and roll your quadricep muscles and kind of massage them. You can kind of just work your way all the way down to the top of the kneecap. Don't go onto the kneecap, and then just work your way back. If you find a tender point, you can kind of pause. If it's on just one leg, say my right leg, I could sit here and kind of bend the knee to kind of add a mobilization with movement. If I need to target one leg a little more than the other, I can kind of take my weight and shift it onto just one leg. Even rolling a little bit to the side and getting the vastus lateralis muscle, our biggest quadricep muscle, can help to reduce kneecap pressure and pain. Okay, so with this foam roller mobilization, you can basically do this every day as much as it's helpful. You don't want to spend too much time with it, maybe 1 to 2 minutes, just kind of rolling through your quads and kind of loosening things up. And again, often a really useful one when your pain is more acute and irritable, just a way to take pressure off the kneecap and reduce pain. For our second exercise, we're going to stretch our quadricep muscles. You can do this in different positions. You can even, standing is a common one, sort of a runner's stretch. I'm going to show it in side lying, but again, you could just do it standing. So I'm going to target my top leg. What we're going to do here is lay on your side. You're going to grab your ankle with your hand and pull your thigh so that it's in parallel with your trunk, or even a little bit behind into hip extension. So you're looking to create a stretch on the front of your thigh, all the way from maybe the top of the hip down towards the kneecap. Again, those quadricep muscles run all the way down over the kneecap and attach down here on the tibia. So we're looking to stretch them. This can often help to, like the foam roller technique, reduce tension and pain when my kneecap is bothering me, or if I'm going to do an activity that will trigger my kneecap pain. Doing this beforehand often really helps. Say like I'm going to go running, or I've got leg day and I'm going to be doing some squats. If I do this beforehand, it helps to take pressure off that kneecap. Now, if you hold it here for too long, the pressure might build, so just take a break. You might be doing, 15 to 30 second stretches. Just base it on how your kneecap does. So you're just pulling back and looking for a stretch on the front of the thigh. Okay, so that's our second technique, a quadricep stretch. When we look at the research on patellofemoral pain, it really supports a combination of hip and knee strengthening. So this is where we want to put a lot of our focus. There's a ton of hip strengthening exercises. We're really looking at our glute muscles, especially gluteus medius, gluteus minimus. So again, there's a lot of choices, but one of my favorites to give people in the clinic is called a lateral squat walk. So what you're going to do is take a loop band. You can put it either around your ankles or your knees. The ankles is harder. It puts more challenge on the glutes and has been recently shown to increase activity in the glutes, but if that's too challenging, you could put it around your knees. So what you're going to do is put your hands on your hips, kind of sit back into a little bit of a squat, and then you're going to step to the side. And what you're going to do is lead with one leg going one direction. You might go 20 paces. I don't have as much room here, but you'd keep going, and then you'll go back the other direction, leading with the other leg. So you're keeping the band on tension the whole time. Don't pull your leg in too close because then you'll lose the tension. So you want to keep it up here, keep the tension on it, and walk across. So again, one leg leads one direction, 20 paces or so, and then back the other direction. You should feel a good amount of fatigue out here in this kind of back outer pocket area of your hip abductors, gluteus medius and gluteus minimus. Okay, so that's the first area we're going to start on. If your kneecap is really flared up, you might just start with strengthening your hips because this doesn't tend to make the kneecap a whole lot worse. The next exercise is going to be for the quads and the knee more specifically, and if people are really having acute pain, sometimes that is not possible right away. So start with the foam roller and the stretch and the hip strengthening. As things get better, you can go to the last exercise. Our last exercise here is going to target the hip and the quads. Like I said, just be careful as you ease into this one. It does put more pressure on the kneecap, so just listen to your body and do what you can. So we're going to do a single leg squat. Again, this is great for the hips and the knees, and we're going to hip bias it a little bit. So it's going to look kind of like a skater squat. So what I'm going to do to make it target my hip a little more and take some stress off my kneecap is to lean my trunk forward. So I'm going to do a single leg squat where I lean my trunk forward. See how you can see how it kind of looks like a speed skater position. This is going to work my quads and my glutes. A single leg squat like this where my trunk is upright works my quads more, but that also means it puts way more pressure on my kneecap. So when you've got patellofemoral pain, you want to think about leaning your trunk. This helps to target the glutes more and take a little bit of stress off of the quads and the kneecap. So you're going up and down like that, just as deep as you feel comfortable. Kneecap pain will usually also feel worse the deeper you go or the farther the knee goes over the toes. So just figure out where your current tolerance is at, and as you strengthen and progress gradually, your capacity will improve. So with this exercise, you want to shoot for 3 sets, basically to fatigue or where pain starts to pick up, but you're probably going to be somewhere in that neighborhood of 10 to 15 repetitions. So, and I would do these on both sides. Even if you've only got patellofemoral pain on one side, it's always a good idea to strengthen the other side. Okay, so those are our 4 exercises for patellofemoral pain syndrome. If you've got any questions, put them in the comment section, and I'll see you guys next time. Bye.